Senator Mikulski, we established last year the National Cybersecurity Center of Excellence, and we're fortunate to have Nate Lesser here today to tell us a little bit about that from the center as a whole, as well as some of the current activities that we're pursuing within the center related to the healthcare space. So with that, I'll go ahead and invite Nate up.
Thanks, Kevin. So I have the unenviable task of being the guy that stands between you and the next break, and which is actually the last break of a two-day conference, and also the guy who has to follow Kevin. So that's always a challenge. You've heard now from Deborah and then from Kevin about a couple of public-private partnerships, things that are going on both at NIST and out in the healthcare industry, the NHISAC, where government, private sector, academia and other organizations, nonprofit organizations, are coming together to try and solve a lot of these big challenges. We are, at the NCCOE, the National Cybersecurity Center of Excellence, another component, another building block in that chain of public-private partnerships attempting to solve this significant and intractable challenge. I will do my best to keep it short, recognizing that we're coming to the end of the conference here, and give you guys a few minutes if there are questions to try and answer those. Let's see. At the center, our goal, and so Kevin had an opportunity to talk about the framework. NIST writ large is mostly a standards development organization. At the center, we have a little bit of a unique mandate to take the standards that are developed by our colleagues across NIST and across the federal government, across industry-led efforts, and internationally, domestically, effectively anywhere cybersecurity standards exist, and attempt to create demonstrated solutions that we can build in our lab to show ways to reduce barriers to adoption of secure technology. So if you think about security, and we spend a lot of time talking largely to cybersecurity professionals, so it's exciting for me to have an opportunity to talk to a group of people who I'm certain there's a lot of cybersecurity expertise out there, but is a group that is not specifically a cybersecurity organization. When we think of cybersecurity, we think that cybersecurity should be practical, usable, standards-based, cost-effective, and mission-driven. So what does that mean? It means cybersecurity shouldn't break your business process. In the healthcare community, I like to use the example of a doctor who came to me and said, I have this fantastic application on my phone. It allows me, it's HIPAA compliant, it allows me to review patient data. This happened to be a neurologist. And he said, I can see MRI scans that are delivered to my phone in a secure fashion. The problem is they take 5 minutes to render. So instead of using this application, his residents go pull up the MRI image on the screen, and they take their phone and they take a picture of it. And then they send that to him completely unencrypted and insecure. On some level, we can't really fault his residents or him for using that approach. If the cybersecurity, if the secure mechanism we have available to us doesn't work within the business process, then we aren't doing our jobs. So how do we make security usable? How do we make it practical? Cost-effective is another real challenge for cybersecurity. We like to, especially on the technology side of cybersecurity, we like to say, hey, we've got this great new widget, this great new whiz-bang thing that if you install, you will be secure. Right? A lot of people will say, we've got the silver bullet. Typically, I would always caution, don't trust anyone in the security space who says, if you just install my thing, you will be secure. That can't possibly be true. But we do like new technology. We like to play with new gadgets and gizmos. So the question is, how do we find ways to make these new, better approaches to security cost-effective? Also, we think about the technical barriers to adoption. So if you look at Goal 2 under our goals up there, at the center, one of our strong focuses is on increasing the rate of adoption of secure technologies. So it's our belief that secure technologies exist to solve a lot of the low-hanging fruit challenges that are out there. Yet there are barriers to adoption of those technologies. We typically break those barriers into three buckets. They're economic, so they're to the cost-effective question. They are technically challenging, so there's a barrier that just says, yeah, you know, I'm a CIO and I have a million different things on my plate, and the new thing that you want to do doesn't integrate easily into my existing technology base, my installed technology base. Or there are educational challenges. As organizations in the healthcare space, we either don't know what's out there and available to us. At times I think that's true. There are a variety of technologies out there. Or they are just too difficult to implement. We don't have the right staff or the right personnel, regardless of the size of our organization, to implement them. So at the center, we believe we can reduce barriers to adoption across all three of those buckets by creating example builds of integrated, secure, composed solutions. So what does that mean? It means that we're going to tackle a challenge that's brought to us, and we've had in the short time that we've been in existence, we've been lucky to have a lot of industry organizations coming to us and saying, hey, we have these challenges. And so we say, all right, well, help us to understand what your challenges look like, what your business process looks like. And when we can distill those challenges into what we call a use case, into an example of how the sector is facing a specific cybersecurity challenge, then we tackle it through the creation of an example build. We bring in technology vendors who provide security technologies, who provide technologies that are specific to the sector, in your case, healthcare, of course, so an electronic health records vendor, and help to connect up the technologies that will allow for the secure exchange and processing of healthcare data. I'll illustrate that through an example a little bit further on, but I'm going to talk for a couple of minutes about the center first. So the center, I mentioned we are part of NIST. We exist in partnership with the state of Maryland and Montgomery County. So we already are kind of in a unique and exciting place where we have lots of resources to draw on from the public sector that's not just federal. And then the way in which we go about tackling these challenges is in partnership and collaboration with the private sector. So we have wonderful resources that we can draw on from NIST, from the Computer Security Division at NIST. I think I may have not spelled out CSD. My apologies. But NIST has a long history of developing standards for the computer security space, primarily focused on securing non-national security federal systems. And coordinating the international efforts around a lot of the cybersecurity technologies and cybersecurity standards that are out there. So there's this great wealth of expertise that we can draw on being a part of NIST in order to take some of those standards and figure out ways to concretize them to drive specific applied solutions into various different sectors. So I mentioned there are three ways that we partner with the private sector. The first is through organizations, through groups like this one, through organizations like Deborah's at the NHISAC. We partner with organizations within specific sectors who bring cybersecurity challenges to us or whom we reach out to in order to better understand the sector. So in the healthcare community, that's hospitals and doctors and small practices. It's hospital systems and insurance companies, so that we can, and I guess also, of course, the medical device community, so that we can better understand the challenges that you're facing. So this is a theme that you heard from both Deborah and Kevin that I will reiterate. We very much value and can't do anything successfully without the participation of your organizations, of people across the sector who are coming to us and saying, here are the challenges we have. And when we hear, oh, okay, great, this organization, there's a hospital system that has a specific cybersecurity challenge, the first question we have is, that's fantastic. Is it something we can solve? How do we scope this challenge so that we can, and I refer to when we scope it, we want our use cases to be narrow and long. So we want them to be narrow enough that it's a challenge we can actually tackle and create an example solution for, and long enough that it's something that's not typically solved by any one technology. If there's a company or a slew of companies out there that are providing a solution to that, then there's not really a space for us to play, and we could simply point you to a specific or set of vendors that are out there. The other question that we typically ask is this a challenge for you, a specific hospital system or an individual provider, or is it a challenge that's generalizable to the entire sector? And if we can get through those two hurdles, then we're at the point where we have something that's we feel is a challenge that the center is really ripe to try and to solve, to create an example solution for, and then help reduce those barriers to adoption of technologies that might solve that across the sector. So that's how we partner with what I will, from this point forward, return to as our community of interest. The people who are, at the end of the day, the end users or, frankly, the customers of the center. The community that comes to us, brings us challenges, and keeps us honest through the process. So I'll talk a little bit later about how we seek input throughout the process and validate the work that we're doing with the community of interest that has come together to bring us these challenges. The other side, the other two ways we collaborate with the private sector are on the vendor side. And that splits into two communities. There are vendors who bring specific technologies to solve a certain use case, to build to help us build this composed solution for a specific sector, for a specific use case. And a good example would be the EHR or EMR vendor. Another example might be if we're doing something in mobile devices, someone who provides an MDM or a mobile device management solution. We also have partners, and this is the next slide, that we think of as NSEP or core partners, partners that persist across multiple projects, across multiple use cases. And those are the big global IT companies and then a couple of smaller security companies that provide the ubiquitous solution in a certain space. These companies, the 11 that are up there, have all signed partnership agreements with us and are committed to sending technology and engineering staff to the center to tackle projects across multiple different sectors. So that's very exciting for us. It's a good group of companies. It's companies that in many cases have collaborated with NIST on a variety of projects over many years, but today have dedicated resources to work with us at the center in order to build these example solutions. So the two things on the bottom there I think are important to note, and I'll reiterate. These are companies that are providing the center with technology and engineering resources. So the center is a fairly, from a federal program perspective, a fairly small organization. We have a technical staff that's today about 4 or 5 people. And yet we are able to tackle these very large and significant engineering problems because we do it not by ourselves but in collaboration with a variety of companies. So in the first of our healthcare projects, the first use case under our healthcare project, we have 22 companies at last count, who have come to us and said we are willing to spend time and energy and give you our technology to help solve the specific challenge that you've presented. So let's see, that's how we partner. So a little bit about our business process. This is a high-level slide. Again, it all begins with the private sector. It all begins with the sector we are hoping to support, the community of interest that comes together and says, here are our challenges. It starts in most cases with a couple of meetings with individual organizations, and then a workshop at the center where we host a few organizations who come in and spend a couple of days with us to help understand their sector. You'll see as we get to, there's another slide in here where I talk a little bit about the HIPAA security and privacy rule. You'll see we are not experts in any one sector. We are cybersecurity experts, and therefore we need to learn from you what your industry looks like. In order to build a cybersecurity solution that actually is usable and practical, as we mentioned right at the beginning, we can't do that without understanding what your business process looks like. So a little bit more detailed slide, which, well, actually, you might be able to read it. I was going to say there's no way anybody's going to be able to read that. A couple of things that I think are important to mention on this slide. Again, security, it has to be practical, usable, standards-based, cost-effective, and mission-driven. So in order to get to that, we are constantly in this feedback loop. If we build something, we publish it on our website, we say, here is the work that we've done to date, and then ask for your feedback. Help us course correct. Make sure that we're honest. Make sure that at the end of the day, when we release these builds, we call the material that we're putting out at the end of the build a solution set. At the end of the day, when we say, here's the full specification for how you can duplicate what we've done in the lab and hopefully deploy it in your environment, we need to make sure that that's useful for you. If it's not, then what are we doing here? And the way in which we believe we will ensure that throughout the process we're working towards something that is in fact usable in the healthcare community is by working with the community of interest to solicit feedback at every stage along the way. So our draft use cases are published on our website for comment. After we bring in the vendors and set up the collaborative agreements that allow them to provide us with technology and engineering staff, and we start building, we'll host regular teleconferences that are open to the public where we can seek your feedback and present some data about status. As we have artifacts and products to release, a bill of materials, for example, to address a specific use case or a specific build, that material goes up on our website and we solicit feedback. The stronger the community of interest is, the better the solutions will be. As I mentioned, this is an example. So we're going to tackle in the healthcare space, our first use case is on mobile devices. So let's see if I can get there here. Great. A doctor using a mobile device collects patient data and then refers that patient to another doctor. So the patient data is collected on a mobile device. The application on the mobile device submits that data up to a certified electronic health record system that's stored in a cloud infrastructure. And then the doctor refers the patient to another doctor who, using a different mobile device, is able to review the same patient data. So setting aside the interoperability challenges, which is something that there are lots of organizations out there working to tackle, we're focused very much on the security challenge. We need to look at securing the mobile device, securing the channel, securing the technology stack where the EHR is stored, so the entire cloud technology stack, securing the EHR itself, then securing the secondary channel where the data is submitted to a second doctor, the referral doctor, and the referred physician's mobile device. So that's a fairly, going back to what I said before, long and narrow. It's a fairly long technology stack. We need to ensure security across all of those individual components. Today we are at the point with this use case of it's been up on our website for a while. We got some great feedback. We tweaked it, made some changes. We held the vendor conference, and the CRADAs, I think I saw last night, we are on the cusp of sending those out to our collaborators. So CRADAs are collaborative research and development agreements. I'm sorry I didn't spell out that acronym. And those are the agreements under which we are able to collaborate with individual vendors who are coming to provide us with solutions. That's that 22 companies I mentioned before. So those should be going out in the next day or two. And then we are, as soon as they review and get their lawyers to sign off on it, we're off to the races. They come to us with their technology and their engineers, and work begins. After we begin working on one of these solutions, we're going to be holding regular teleconferences, as I mentioned before, and soliciting feedback from the community of interest. So I keep plugging this, and I mentioned again, I suspect within the room there are, I think what I saw is there are a good number of vendors in this space, so this may be something you're interested in participating in. And then I think there's a broad array of folks who might be interested in participating in our community of interest, and we would certainly value your feedback and love for your participation as a organization that might adopt one of these solutions. We would love to help make it as useful to you as possible. So that's I should mention, so there's a high-level architecture for that use case. This is just the first use case in the healthcare space. We're expecting to do others, and the community of interest, again, we solicit feedback and input from the community of interest as to what use cases would be most useful for you to see an example built technical solution. So We've got the mobile device one underway. We've been talking a little bit about the possibility of doing a medical device use case. There have been some discussions about doing a use case from the payer side, some discussions about doing a use case from the patient side, and patient review and control of their own healthcare information. All of those are, I think, valid, and I'm sure there are quite a few more that would be applicable to the organizations that you work with. This is an example of what the statement of work for a collaborative agreement looks like. Effectively, again, it goes back to these two things: engineering staff and technical and technology. So at the center, we have this great collaborative research agreement available to us. It's something that I think primarily the science-based organizations within the federal government have the authority to do this, and it allows us to sign an agreement that is a fairly lightweight agreement. It's not a contract. It doesn't go through a large procurement process. There's no exchange of any money, but it allows us to work collaboratively and transparently with private sector organizations who can bring us their technologies and help us to integrate their technologies with others in the stack to create a more secure whole. So this is the slide I think I mentioned before. This is what I understand about the HIPAA security rule and the high-tech security character. So what we do when we create a use case is specify the security characteristics, the technical requirements and security characteristics necessary to ensure that the whole is in fact greater than the sum of its parts. So at the end of the day, when we build a solution that is an integration of 10 or 15 different technology vendors' products, we want to make sure that we are actually, in fact, building something that is more secure. So we talked about the usability and practical nature of security, how it needs to be cost-effective and mission-driven, but it also needs to be secure, right? It needs to be more secure. So the idea that something is secure goes back to what I was saying before. It's like someone telling you they have the silver bullet that will make your organization secure. Don't trust them. We're not saying that this will make your organization secure. We're saying you've presented us with a challenge, or we've heard about a challenge in your community, and here is an example of a more secure way to do it. So it doesn't mean that it is also the only way to do it. Again, it's an example, and we hope that when we build a technology stack, we create a build on one platform. If you, in fact, don't use the types of routers that we used in our example build, or you work on a different operating system, you'll still be able to take ours and try porting it to your operating system, porting it over to your environment, and we hope to hear about the challenges you have with that so that we can help solve, or others in our community of interest can help solve those challenges. So that's pretty much what I have to say there. I think we are good. Yeah, look at that. I was pretty fast. Any questions? No? Great. All right, well, I'll give you back a couple of minutes and let you get to your break. Thanks.